the body, for some reason, we don't really know why, has an incredible ability to learn how to metabolize ketamine. It's very, very rapid. There's no dependency. It's not like you're going to have cravings or withdrawal symptoms from not getting it. So dependency and tolerance, people often get confused. Tolerance is just metabolics.
All right, my YouTube friends, hello, hello. My name is Anna Kristal, and I want to warn you, I want to give you a heads up that the video you're about to see is not made for YouTube. It is a video recording of a podcast recording. So you are so welcome to go listen to the podcast wherever you listen to podcasts. And if you're visual and you prefer to see the interview happen, then please enjoy it here. I'm so happy you're here. Let's get into it. Ketamine Connections, welcome back. What a treat you are in store for. So many firsts with what you're about to listen to. This is the first repeat guest that we've had on the Ketamine Connections podcast in over a year of weekly episodes. It is our first two-part episode, and it is the first time that I share part of my psychedelic experience live time from a journey. Dr. Austin Harris was first featured on episode 38. So great. Check it out if you want. You don't need to have listened to that episode to get what you need to get out of this episode. In the beginning of this episode, I go through some of the talking points from that one, some of the things that I wanted to highlight, and we get deeper into it. This episode gets a little bit more technical than we usually have on the show. Usually I'm highlighting more stories, but I loved the gold, the scientific nuggets of wisdom that Dr. Austin Harris shared with us, and I wanted to keep that in here. One of my favorite parts of the conversation that was part of the technicality was what we call a window of tolerance. So we have a window of tolerance of what we can tolerate, makes sense, from high frequency emotions to low frequency emotions. And we got into that conversation talking about how we all have it, how our society conditions us to be in a certain relationship with it, and how we really need to assess it and change it if we want to change our lives. Another part of the conversation that I loved is how there are so many gifts of desperation, of crisis, of depression, of these states that really motivate us towards change. I hate to say it, but I want you to think about it of a time in your life where you were trying something over and over and over again. I'll give a super mundane example like losing my keys. I do that all the time. God bless. And I check in one place, I check in another place, I check somewhere else, I check somewhere else, and then I just, give up. I'm just like, I'm not going to find my keys. And in that example, I do have my own way of recovering my lost keys. It's a fun way that I interact with my intuition and my guiding system. Aside from the point, we all have that story that we can think of where you lose desperation, where you lose hope, and you just say, okay, whatever I've been trying is not working. I'm willing to try something else. And I will say from my own personal experience, we talk about in the episode, the two-part episode that you're going to listen to, the first part of this week, is my own personal story of my life reaching that point in the fall last year. My life kind of fell apart. I talk about this in other episodes as well, just relationship, housing, a whole bunch of things all fell apart all at once. And at that time, I was really sick. I had a bunch of different things in a row. I had a double ear infection, I had double strep throat, and I had COVID all in a row. I was sick for 2 months. God bless my immune system. I've never been sick that long in my life. And I know that my spiritual support squad, as I call them, when something big needs to happen, when I'm on a threshold and they know I'm so strong, I'm definitely stubborn and I'm going to fight back, or I'm going to try to hold structures together that aren't meant to be held together. And it is in that moment of desperation, of crisis, of just pure KO moment of like, I'm knocked out, like, take it from me. I can't hold on to it. And it's really common in my life if I'm going through something spiritual that way, if I'm letting go of an old belief system, if I'm moving through a threshold from one way of living to another, it is inevitable that my sleep will get knocked out. I'll get some sort of sick. And I know that that's for a reason because I'm otherwise really strong and I keep fighting. And I've heard this from a lot of people that I respect and know as well, that when you look back at those moments, those bad trips, those terrible situations, and you look at what happened on the other side of them, it's always, most of the time, a blessing. It's usually something that you grow through. They call them growing pains for a reason, because we don't want to grow. We don't want to evolve. The ego, which we talked about a lot in this episode, the ego wants to keep us safe, keep us contained by keeping things the exact same way they've always been. And we talk about what's on the other side of the ego. Dr. Austin Harris has a really interesting protocol, and he talks about pushing through to the other side. When I went to see him at the clinic, I had no idea what that meant. And then I got to experience it. So we talk about how ketamine is really unique in that, in its administration through IV ketamine specifically, you can have a sustained ego disillusion, which with other psychedelics, yes, you can have moments of it, you can have glimpses of it, you can touch it. But what I experienced, and what Dr. Austin Harris really beautifully and smartly lays out for us in this episode, and in the episode, the part 2 of this episode as well, is the ability to have a sustained ego death and what happens. And I get to share my story about that. I'm so excited for you to hear this. This is part 1 of a 2-part episode. Come back next week and we will have part 2. Dr. Austin Harris, Dr. Harris, back on Ketamine Connections. Welcome back.
Thank you so much, Anna. Thanks for having me back.
This is a never before done episode. We were talking about that before we hit record. So, one, you are our first repeat guest. The first episode we recorded, I told you, was doing well. That conversation is resonating with the audience. We're getting good feedback on that. And as good as it was, this episode is totally different. The intention is 3 parts. Step 1, tell the story of what happened after that recording, because I teased it in that episode that I came and I saw you at the clinic and received a session from you. And so tell that story. Also, to ask you questions about your process, because it's so innovative and I want to know more about that from your perspective. And then 3, talk about my integration from having received that session. I mentioned it in the recording for the last episode that as magical as that session was, that same day, like literally that same day, I felt so much better. And I've been doing this work long enough that I know that it's okay. That was me entering the theme park going, wow. But now I've actually gotten to ride the rides. And so it's been about 6 weeks since I saw you in Sherman Oaks. And so since then, it's like, wow, like the integration has really been more full, more embodied, and just more of that I want to share as well about my insights and things like that. So
Beautiful.
That's what we're diving into. I just want to let them know that it's episode 38 on the show. And I have a few bullet points here of what we talked about on that episode, so people kind of know where this conversation is going to go. So we're going to talk about this more, about the ketamine protocol that you have that is unique because it's a longer protocol. You're titrating the dose as the client is in the session. So it's not a set it and forget it model like other clinics have. We'll talk about that. We talked about how ketamine reactivates the brain's neuroplasticity. We're definitely going to talk more about that, especially as we talk about the integration and my lessons and my takeaways and things like that. I love what you said about you cannot think joy. Definitely want to dive into that. And your thing about the subconscious mind lets go of the weight out of the back door. And just how talk therapy doesn't really work to repattern the subconscious mind, and how to make the most out of ketamine, you need the integration, you need the mindfulness, you need the modalities that support the epiphanies that you have, because you can have the most amazing experience in ketamine, but then what do you do with that? How do you take that home? How do you integrate it? So that was actually the first episode. We're going to expand on a lot of those points today. And for those that didn't hear the episode before, I definitely recommend listening to it. The coolest thing about that was we met on the recording, and at the end of it, you were so generous, you were so inviting, so gracious, and you said, hey, if you're ever in the area, come out and experience this. And I happened to have already a trip planned, and I saw you, I think it was 2 days later, in Sherman Oaks. And the synchronicity of that was just incredible.
And it was a joy for us as well. email, then a phone call, then a Zoom meet, then meet you in person, and to be able to provide the experience that you receive. That's really the joy in what I do is working with real people,
Mm, mhm.
and seeing that before, during, and after that transition, that shift that people are able to receive. I commend you and want to reinforce the things that you said, in that our programs here, which we can maybe touch on to maybe folks that didn't catch the first episode. Too often ketamine clinics, or really psychedelics in general, medications in general, are just sort of like, here you go, here's this molecule, good luck, have a nice life.
Yeah.
I guess that makes a lot more money for clinics and pharma companies and things like that. But that's not really helping people to be able to use something. Like, what do I as an individual do with this? How do I now approach my daily experience, which is supposedly why we're doing all these things, taking these things, having experiences, is supposed to be able to add value, insight, or provide a neuropsychological, physical, or practical shift in how we invest ourselves in our daily experience, moment by moment. So if we don't do the okay, now what? We're just, I think, leaving 90% of the benefit on the table.
Amen. It's something that I say often, that if the difference between ketamine is something I tried and ketamine changed my life is what you're talking about. It's the mindfulness practices, it's the things that you do to reinforce those neural pathways that are so fresh so that you don't go back to the old way of being. And that's something that for me, why I said yes to this infusion that you offered me. For the record, I get invited to a lot of ceremonies. I get invited to a lot of different things. Just for life purposes, I say 90 no to 90%, because I can't be in ceremony all the time. And I also don't want to be, because I know that the magic is in the parts around it, right? And if you look at
Mm-hmm.
how psychedelics were used in indigenous societies where all of these medicines come from, it's a pattern interrupt. Are we meant to interrupt a pattern all the time? No, it's you
No.
interrupt the pattern, and then, like, right, it's like you shake up the snow globe and you let the thing settle before you shake it up again. For me, I had been doing so much work for months, from starting around November until April. And so that 6 months of like really deep inner work. And I can talk about more about that later, of what that looked like, but just brief overview: a lot of hypnosis, a lot of meditation, a lot of yoga, a lot of prayer, a lot of having difficult conversations, which is so healing in itself.
Versus avoiding them.
Correct. Or numbing and pretending like they don't need to
Mm-hmm.
happen. All of that,
Mm-hmm.
right? That's a form of avoidance. And so for me, it was, wow, this process is so unique. I'll talk about this as well, that I do have a higher threshold for psychedelics. So actually higher dosage works really well for me. And so that was
Mm-hmm.
something of like, whoa, this guy's like really going there with the way that you're doing it, like the timing and also the dosage. And it just was like, it felt like a full yes in my body. I was just like, yeah, I want to go try this protocol. And so it was just the perfect time to, I talk about this a lot actually in the ketamine preparation protocol, of crossing the threshold. I had been already walking through the dark for months and months in that liminal space of like, oh my God, I took off the coat of who I was, and now I just have raw skin, and I'm walking through the darkness, and I am just like
Mm-hmm.
so raw, so uncomfortable, so everything. And I was like, oh, I feel like the fog is lifting and I feel so close to the other side. And then you offered the infusion. I was like, okay, let's go. Like, let's see what happens.
I say this all the time. The reason that we as human beings tend to not change or heal or grow is because we, just in general as a society, we have now been so brainwashed to avoid discomfort, right? Of any kind, right? You're not allowed to feel anything that you don't control. So it's that delusion of I can control what I feel that has become normalized, and it's so completely toxic and irrational. Um, and so what does that leave us? And it's very abnormal, irrational paradigm has now become so embedded and reinforced in our culture that, well, the only place where I might be able to maintain that delusion of control equals I can somehow control what I feel, which isn't really true, but it's an illusion, is in my own head,
Mm-hmm.
right? Which is by definition not real, right? Our thoughts aren't real. They're not who we are. It is by definition an alternative to reality,
Yeah.
right? It's an avoidance defense strategy. It's not feeling a part of, with, and, alive. So it is that totally historically bizarre concept that we can't allow ourselves to feel anything uncomfortable or different or not in our control, that I think feeds too much into our existing ego defense structure that we're all born with. And if that is over reinforced, starting at a young age, usually, we're in serious trouble.
Yep.
And, the courage, right? Maybe the gift of desperation, but also the courage to become uncomfortable, to let yourself feel things, both from our environment, but also processing requires feeling. And, people always say, I'm processing, no, you're not. You're avoiding, you're thinking, you're analyzing, you're distracting, you're just letting time pass, you're numbing. That's not processing. Processing is being willing to welcome that suppressed emotional conflict to rise and release. And as it releases, you feel it, right? It ticks the sensor on the way out. It registers. That's how you know that subconscious inner healer system that we were all born with is doing its job.
Right.
So we have to allow that discomfort, or just not controlling what we feel, to occur in order for us to have value.
Absolutely. And this is our window of tolerance. It's like I can only tolerate discomfort to this amount. However, what we know is that your window of tolerance goes, you have the upper limit, you have the lower limit. And so your ability to handle, those tough emotions, if people don't know about like the emotional frequency scale, every emotion has a frequency, like a number on a scale. Shame is the worst emotion, like the lowest frequency emotion. And then
That makes
love
sense.
is the highest. And so it's everything in between. So if you're like, oh, I'm only hanging out in that midsection, like, well, guess what? It's like at the top, you have everything that people want for their lives, their family lives, etc. Love, joy. And then at the bottom, you have shame, you have fear and things like that. And you're like, well, I'm not going to go into my shame. Well, guess what? You're not going to go to your love either. Like, you're not going to go to joy.
Even the concept that somehow we can artificially maintain that like average middle is in itself an illusion. The only thing we can do is choose as an action, moment by moment. Where do we invest the bandwidth of our awareness?
Yep.
Where's our focal point? Is it going to be feeling, doing, being, experiencing, sight, sound, taste, touch, smell, present here, allowing the vulnerable, not controlling, but I still get to choose where I focus that investment, right? That's my power. Is it going to be out here in the real, or is it going to be in the unreal? That retreat into the unreal, our thoughts are apart from, was never supposed to be sustained,
Right.
right? It's supposed to be, gosh, moments, hours at most. But if it's reinforced as like our way, our true self, our uniqueness, our control, our safety, as a neuropsychological embedded, anatomically reinforced way, goodness. Because eventually that thing, that mode that might feel like a temporary respite from feeling that which we don't control is only going to reinforce itself to a degree that is going to become pathologic.
Exactly.
It's going to harm us. It's going to become a self-reinforcing mode, neuroanatomically as well, to the point that now it's going to beget the discomfort because all we're feeling is our own thoughts. Then the thoughts will start to change such that we maintain this sort of stress response, creating the anxiety that doesn't need to occur, such that we can reinforce that I got to stay here in this little castle. So it's always going to end up becoming pathologic if we try to control our range.
Exactly. And the thing that I'm so clear about is that it's our comfort zone. And when I talk about this with clients who have, 20 years of depression, like all of these disorders, all of these diagnoses, et cetera. And then I go, hey, like that misery that you feel from overthinking, control, all of that, like, can we just be honest that that's your comfort zone? Can you just be honest that like if you just drop the what ifs, anxiety is a sort of overactive what if
Mm-hmm.
mechanism. If you just drop that, like how uncomfortable it is to be with the unknown. And that's what we get to practice with psychedelics, which is why the ripple effects of that are so incredible. And it's a practice, right? You don't just like pick up an NFL player didn't just pick up a football one day and now is in the, in the Super Bowl. It's like they log the hours, and it's like what you're saying with pathological is something that we've practiced. And when I heard this, one of my first teachers, I think it was 10 years ago, said to me, "Oh, anxiety is just something you've been practicing." I was like, fuck you. And then 2 days later,
What right do you have to label me as blah, blah, blah? That's just our ego going, oh, damn, that was over the target.
exactly. Like, oh, you hit an ouchie spot, right? Like, oh, fuck
Yeah.
you
Too
for
much truth.
too much truth. And then later I was just like, as I went about my day for the next few days, I'm like, oh, I really do practice anxiety. Like, I'm anxious. I'm going to be late to work. This is
Mm-hmm.
another time in my life where I could be late to something. I can't be late to anything anymore. I was anxious about waking up, anxious about making sure I had everything packed. Like every moment of my day was filled with anxiety because I had been practicing it for my whole life. But my question for you is, how did you develop this protocol, right? We're talking about you do 2-hour infusions, not for pain, because usually the longer infusions are for pain management. So this is for, mental health, psychological benefits, longer infusions, higher dosage, titrated as the client is in the session. Tell us more about that.
Sure thing. So, I do know a lot about neuroscience. Being a cardiothoracic anesthesiologist, the situations that I'm subspecialized to succeed in are hairy situations. Heart failure, like massive heart failure, like doing a transplant, major trauma, things like that, where it's all about the fine adjustment
Okay.
that makes or breaks a situation. So a person like myself, I guess it's somewhat self-selecting, maybe a personality structure that you want everything you want to just get it perfect. You're always trying to adjust and optimize. I've done aortic aneurysm repairs that are 16, 20-hour
Wow.
surgeries, like high drama and risk and everything. It's something that for me is instinctive. It's something I'm drawn towards, that titration, or what the layman's would call like adjusting
Yes.
the delivery of something in real time, moment by moment. And you're analyzing the effect of what you're doing,
Right.
and then you're changing it to get the result, that the perfect
Mm,
sort of state or set of vitals or conditions that you're trying to adjust to. And that will change over the course of time during the same surgery, anesthetic regimen, ketamine infusion, right? Because we're changing,
right.
right? Our metabolic tolerances are changing. That's a thing that I think most providers of ketamine still don't really understand.
Okay.
The body, for some reason, we don't really know why, has an incredible ability to learn how to metabolize ketamine. It's very, very rapid. There's no dependency. It's not like you're going to have cravings or withdrawal symptoms from not getting it. So dependency and tolerance, people often get confused. Tolerance is just metabolics. For some reason, our body, ketamine, it's almost all liver metabolized in cytochrome P450 enzymes, like many other medications and molecules. But for some reason, it is adapting to learn how to break it down faster and faster and faster, really rapidly. So much so that that tolerance or metabolic breakdown ability increases during the same infusion.
What?
So if you were to keep the same dose delivery rate from the beginning to the end of an infusion, your actual depth of experience would steadily decline
Okay.
from beginning to end. So knowing that, why are they not doing it? They either don't know that they need to, don't know how, or, and I think this is true at scale, it's not profitable.
Right.
A clinical model usually in modern medicine is based on volume. So having a team that knows how to do this differently for different people, because there's so many factors in each person, right?
Right.
And that those factors are also changing in real time, day to day, or within the same infusion.
Wow.
To know how to adjust up, down, left, right, based on analysis of what this person is experiencing is a lot of nuance. They either don't want to, or it's just not a profitable business model to operate that way, because you're talking about far higher trained staff. You're not going to be able to really scale that. And, working as a small team dynamic model like that, our profit margins are way lower than these sort of drive-through operations of any kind.
Yeah.
So, knowing these basic things as an anesthesiologist, and especially in cardiothoracic, we use ketamine a lot more because it's very hemodynamically safe.
Okay.
So you can provide sedation pre or post to someone who's very unstable from a blood pressure or a heart rate
I
perspective,
see.
and do things that you need to do prior to inducing or recovering from a surgery, and it's going to be safe. So that's from a metabolic perspective, where we need to be adjusting to people in real time, and that the dose delivery rate and what we add or don't before, during, or after that treatment is going to vary a lot. There are a lot that we vary per person, per visit, because we're trying to constantly learn from the person.
Right.
I personally pre and post integrate with every single client, every single visit, so that I'm sort of feeling out where they're coming from in their last experience. What value can I add to optimize for themselves their approach in the next experience? And then, debriefing that and seeing, okay, now how do I continue to be the best guide, support system, and anesthesiologist in this situation to constantly be optimizing and improving both from my end and from the client's end? Now, when it comes to the duration side of it, this is one of the things that you just don't see out there right now. Back in the day when they first developed studies for ketamine infusions, and let's just pick something, depression.
Okay.
They just arbitrarily picked an hour,
I see.
right? Because they wanted a constant, a control. And then they experimented on a lot of the other variables, dose, repetition, frequency, or time between repetitions in a stabilization process. And they just never really went back and went, okay, but what happens when we do it longer than an hour?
Right.
Now it's gotten even worse than that. Most clinics now aren't even giving an hour.
40 minutes.
Right? Oh, yeah, and it's just gotten less and less and less and less. Now, why? This doesn't even make neurologic sense on its face. Okay, which I'll explain the big concept here. No, they're just, the faster they give the infusion, the less ketamine they give, means much faster recovery. Turn that room over, get another patient in. They make much more money per room, per hour in this model than doing any longer or higher dose infusions. It's that simple. It's the only explanation that makes logical sense for why they'd be doing this.
Right.
But it's become standard.
To
as a business model.
And to your credit, I had a 2 hour infusion at your clinic, and God bless the landing. It took me another 2 hours before I could walk, and I didn't even know that time passed. I had a ride coming to get me. I missed my ride because usually, yeah, I've done most infusions I've done are an hour. I've never done 40 minutes. 40 minutes, I think the IM session I did was about that long because it's a short ride up with IM.
Don't get me started on IM either. IM, oral intranasal, don't work for many reasons. And don't get me started on the at-home
Right.
nonsense,
Well,
which, to your point, these experiences should be an interruption, a rare interruption of reality, not something where we're offering people a constant avoidance of reality through medication that they just get high in their bedroom.
preach. I mean, yes, I rate the types of ketamine, right? Like your nasal spray is your lowest, then you have your lozenge, then you have IM, then you have IV. And for some people, it's like for people like me who are experienced, who are doing so much work outside of ketamine, who are high, like capital T trauma in my background. I was just talking to a medicine man a few weeks ago who I've sat with, and we were talking about high threshold. So I'm a high threshold psychedelic practitioner, we'll say,
Mm-hmm.
meaning that for me, I need a high dose to get over the threshold. And then I'm like swimming in psychedelic space. And I told the medicine man, because the first medicine man I ever worked with, 10 years ago was like, oh, it's because of your Russian heritage. That medicine man 10 years ago had the experience that when he worked with people like me who are Russian Jewish immigrant refugees, that they needed a higher dose. And I've taken that on for the past 10 years of just like, oh, this is my karma, this is my ancestry, this is what I need. And then just a few weeks ago, I was sitting with this medicine man and I was like, yeah, it's all the Russians. All the Russians need more medicine. And God bless this whole like synchronicity. There was another Russian woman sitting right there and she's like, no. And he was like, actually, no. So I'm starting to notice that, yeah, we all work with psychedelics so differently. And for some people, it is a lower dose. Like I'm noticing some of the clinics that I talk to in the middle of the country, right? Like you're in California. I'm mostly from the New York City metro area. That's the place in the country that I basically grew up in. And we have those bookends of the country that are very different culture than the middle of the country. And for the middle of the country, this guy was talking about a lower dose than I've heard. And it's really serving his population. Now, would a dose like you're offering serve, in a different way, bigger, better? I don't know, but it's something that I've been on a journey on for years because I used to be like, get my money's worth, get the most, get up there, like blast to outer space. And then about like 5 years into that, I was like, what's a lower dose like? And I started experimenting. So I do believe there's merit to all sorts of doses. And as you're saying, the pattern interrupt that is like a full spectrum like I had in the infusion at your clinic, because you explained this to me. I tried to find it in the podcast we recorded, and it actually was something you said to me in your office. So I want to bring that into the conversation. You said that you cross through to the other side. Say more about that.
Sure thing. In terms of that point, and then I want to come back to the duration a little bit so we
Okay.
can explain the neurology.
Okay.
When I said cross through the other side, we're talking about achieving and then sustaining a state of true ego disillusionment. And that is one of many reasons why a properly delivered ketamine infusion is so special. It is unique. You can have moments of ego disillusionment with really high doses of other psychedelics, ayahuasca, psilocybin. 5-MeO DMT is a pretty good, as long as you got a reasonable dose, pretty good guarantee of at least a moment or two of ego disillusionment. It's pretty coarse though, so certainly not for the uninitiated. But none of those molecules, no matter what dose, are actually able to sustain in a consistent way that state. So what is that? Well, from a neurologic or a neuropsychologic perspective, it is basically chemically turning off the part of our brain that is so obsessed with being separate, right?
Mm.
I'm in here, I'm over here, and the movie, the world, the rest of it, it's over there. And there's this distance
Mm.
where me thinking that's me over here, and everything else that isn't me and I don't control is over there. And that somehow it should be that way, right? That's what keeps us safe, wrapped in this blanket of control delusion for safety, whatever. And unfortunately, that's been normalized to us. In ego disillusionment, you are, and I use this visual a lot. If you think about this as the reach or range of your defense mechanisms, another good metaphor would be most of us don't realize it, but we've been living inside the walls of a castle
Mm.
with guards on the parapets,
Yep.
right? And the question for each person is simply how far out of those walls? Are they high and tight and claustrophobic, or do we have a good range of stuff in here that we can resonate and sublimate with, right? But we all have a wall.
Yep.
And that's our ego. It's our defense structure. It's something that's been there from the beginning, right? Or certainly the instinct for it. But in ego disillusionment, you are now outside the wall. You're outside two things. One, your ability to even have the illusion of enacting control.
Mm.
But, and while that may make someone anxious as they're sitting here listening to this, because their defense mechanisms are currently online,
Exactly.
right? They're designed to disincentivize us
Right.
from going outside their range, thinking they're absolutely necessary
Yep.
to keep us safe.
Yep.
We've trained them to be that over reinforced,
Yeah.
unfortunately. But the truth is that in the ketamine ego disillusionment experience, being outside that control delusion also means that you're outside the range of your own anxiety, defense structure, disincentivization, being angstfully somehow upset that you're not driving the car type thing. They can't bother you. You're outside the wall, but you're also outside the range of the guards to be like, no, don't go out there, Anna.
And I want to
Right?
say really quickly, you're saying ego disillusionment. And in the psychedelic
Mm-hmm.
space, we have like two ways of talking about this. We talk ego disillusionment, which is the more evolved way of saying it, but back in the days we called it an ego death. And we've evolved to ego death, just like we used to call it, global warming, and now we call it climate change to be more inclusive of the experience that's happening. And ego death it's so real. And what you're talking about, just if someone doesn't understand, is like your defense mechanisms say, hey, if you go out there, you're going to freaking die. And it feels like
Right.
it.
There's something existentially wrong with not having that control delusion.
Exactly. Like it's
Right?
death.
It's a one-trick pony.
Yeah.
Right? That's its thing. That's what it does.
Yeah, that's exactly what it does. And I'm so shook right now because everything that you're saying was my experience. So it's normalizing the experience that I had actually going outside of those walls, because I didn't know there was something to push through. The way that I've kind of been thinking about this is, I'm driving down a road and I hit a rough patch of that road, right? Maybe the road is shanty, or maybe there's a fog, which I think is a better analogy. And I'm in the fog and I'm like, okay, I got to pay attention to driving. And then, I get through the fog, I'm on the other side, and then I'm able to look back and be like, oh wow, that I just drove through fog. And that experience of pushing through to the other side that I had with the infusion that you offered, it was only in hindsight did I was able to see the walls that I was living in. I couldn't
Exactly.
like you said in your office, it's like most of us, we go and we bump up right up against it, right? Like we're just like bumping it, but we're still in it. And then getting to the other side of it, then I'm looking back going, oh shit, that was my conditioning, that was my patterning. And yes, I knew it, but to your point of
conceptually.
Exactly.
But not experientially.
Exactly. Which is the power of psychedelics, is that we have a somatic, visceral, lived experience of like, wait, now I know what it's like to be in the walls and I know what it's like to be out of the walls. That's where I can now do work outside of ketamine to what you were saying earlier. What am I choosing? Where's my attention going? What am I reinforcing? Am I reinforcing the old patterning or the new patterning, and having the power of choice?
Exactly. And the other metaphor I use is we always say these things like, oh, let's be present, live in the moment, just open up. Let's feel more deeply, like connect. And it's like, okay, well, I mean, I understand what the words mean. I understand English, right? I'm not dumb, but I don't actually have that pin dropped on my personal map, right? You say that to me, and it's like, I kind of think I know what you mean, but not as an action,
Mm-hmm.
right? I can't just take that and go, oh, right, that. And I can just vector towards that, enter into that mode, perform that action, experience that state. Too many people don't have that. And it's not a matter of it not being explained well enough. We are not cognitive learners.
Right.
We can think. That's not how we learn and change patterns. We are experiential learners. We have to go through real life data, and that experience alters what we call paradigms. We always talk about a paradigm shift. People think they know what that means. It's like, oh, I'm thinking about it differently. Yeah, but how did you get there?
Right.
Because in a true paradigm shift, you could not have perceived reality
Right.
the way that you now perceive it prior to some sort of new experiential data having taken place between where you were seeing it and where you now see it.
Exactly.
Without this, you can't be here.
Exactly.
It can't happen. What's our paradigm? We think we know what's going on. We have what is best for us, or analyzing the data and our relationship to it in a certain functional paradigm, right? But then suddenly just one little drop of new data comes into that equation that we could not have had access to within our old paradigm.
Right.
That little drop suddenly just percolates
Exactly.
and completely changes the calculation
Exactly.
to a different outcome, to a different number. And we're just like, wait, what?
Yes.
And it's usually kind of like almost it's almost embarrassing. It's almost like oh God, how could I have not seen that?
Right.
It was right there.
Exactly.
But there was no way I was gonna get there
Exactly.
in the old formula.
There's no way to get to it in the old formula, because what you're saying is two sides of the same coin. Right. And so it's like that conditioning, that patterning, that subconscious programming. It's like, I'm either going to reinforce it or I'm going to deny it. And what you're talking about is like, but have you thought of this whole other neural network and this whole other option that doesn't exist? And that's when it's embarrassing, because we're meant to, like, the way the subconscious mind is programmed and designed, it's like this or that, efficiency, simplicity, all of that.
And I usually call that the unconscious mind, right? When I talk about the subconscious, usually that's the thing that's trying to push us towards the right paradigm. We're not letting it, though.
Interesting.
Right? Because the ego defense structure, that neural programming, and those now so deeply embedded that it's not a thought, right? It's an unconscious impulse. Right?
Yes, and I've done a lot of study on unconscious and subconscious just from being a hypnotherapist. And so they're actually interchangeable terms, but there are people that do separate them for other reasons. But what happened was, at first we thought it was unconscious, but when you look at just the word unconscious, that means you're not able to, right? If it's unconscious, it's not available to you. However, subconscious is underneath the surface. So what you're talking about with the work with ketamine, with all of the mindfulness practices, all of the integration work around it, it brings you underneath, right? When you're talking about pushing through to the other side, you're talking about that veil between the conscious and again, I use them interchangeably, unconscious and subconscious, but I have heard so many different theories. I've read so many different philosophers that talk about it differently.
Yeah, the nomenclature, I guess, doesn't really matter. I just think the important thing is that when we turn off the thinking, controlling, defending, and also the unthought instincts that are embedded in that defense structure, just surge of anxiety, like where does that come from? I didn't happen to think of anything. It just happened,
Right.
right? So that's not something that we're aware of, doing. It's just we feel it, we experience
It's
it.
a program.
But for some reason, when we utilize ketamine to achieve ego disillusionment, all that's gone. And yet we're still very much aware. We're not unconscious.
No.
We're in this subconscious dissociative state where we have simultaneously full awareness of our experience, but none of the other mechanisms that we would normally have in a non-egoless ego disillusionment state, even if we were on psychedelics, but not ego disillusionment psychedelic.
Right.
Because a lot of people, they love psychedelics because they feel certain things, but they're very much still like the ego and the defense mechanisms, and those, they're still in the room. With a lot of clients, they think that, well, a K-hole or ego death, or like somehow that's something that's going to harm them.
Right.
So I just basically say you're outside the range. Now, there may be a moment as you're going out of range, right? As you're reaching the end of the length of your defense mechanisms to do what they do,
Right.
where it goes, no, this is not okay. Oh, wait, now everything's fine, right? Because once you're outside, truly outside that mechanism to bother you, you realize experientially, oh, damn, you mean love, self-love, like everything love, comfort, connection, a part ofness, enoughness, oneness, inspiration, hope, joy. You mean that doesn't come at all from trying to analyze the angles in my head? It comes from the realization that I never needed to. Oh,
So I didn't know there was another side to cross over to, because
no one does.
yeah, because I had never crossed it, and only
We only know what we know.
exactly, or we know what we don't know, right? Like I knew that I didn't know, but I didn't have that lived experience of it. And so when I like look back, right, of like, oh, I just drove through this fog. What was that fog? The stories that came up were it's all my fault. I have to fix everything. Everyone is watching me. And it was so real. And I remember being in your chair at your clinic being like, here we go again. Everyone's waiting for me to like figure everything out. There's this Buddhist concept that I love where I am the last person on earth who has not reached enlightenment. And everything in my reality is...
That's a pretty deep level in security.
Well, you can look at it from any angle. You could be like very like self-centered angle, and you can look at it from a responsibility angle, or you can look from it like everything around me is perfect, showing me where my healing still needs to happen. But mine is both. Like in my conscious waking state, it's like very like, okay, everyone is a mirror. Nobody's saying anything to hurt me. I'm just feeling pain because that's my conditioning programming. It's showing me my unhealed parts. But in the ketamine, it's like there's a panic of just like, I have to figure it out, but I don't know what it is. The weight of the world is on my shoulders.
Because you can't figure it.
You cannot.
That's the thing. Experientially, back when we were kids, unfortunately, both of us, and then culturally, it's being reinforced constantly. We have this totally irrational, really crazy belief system that somehow we're supposed to figure it all out. Right? That wasn't a thing in human history until like max a couple hundred years ago. You can go back a little bit further, but like evolutionarily, we haven't changed at all in like 100,000 years. So this is like bizarrely radical this little experiment that we're playing out here, that somehow it's all up to what's going on between our ears to analyze and come to the conclusions that dictate what's good and bad and where all the threats are and where all the angles are and what's the exact path I need to take from A to Z to get to. That's just not how life and reality work.
That is a wrap for the first half of the episode. Please come back next week so you can hear the rest of the conversation. I wanted to give you lots of time and space to digest everything that we talked about today. Crisis being a gateway to change, window of tolerance, frequency of emotion, ego dissolution, thresholds, so many nuggets of wisdom in this show. I hope you enjoyed. This is a good one to revisit. Anytime you want more of a technical refresh on how ketamine is affecting the subconscious mind, I hope you enjoyed it. And I'll see you next week for part 2. Bye. Hey friends, thank you so much for joining me today on Ketamine Connections. I hope that this episode inspired you. I hope that it uplifted you. And I hope it just expanded your mind in some way with some perspective shift. We have been running this show for over a year now, which is incredible. And after more than 50 episodes, we have so many different resources to offer you. And we took all of those resources, we put it into one place called the Ketamine Starter Portal. Check that out in the show notes. Everything you need is there. All of our guides, anything that we've talked about on the show is in that portal. And it's also the best way to get in contact with me, since we are not allowed to talk about psychedelics on social media. Being on the email list is the best way to get updates, to get all of the information that you need, and to stay in touch. So I really hope to see you in there.